Hello and good evening. I'm Melisa Idris. Welcome to The Future is Female. This is the show where we find the extraordinary in every woman. I'm delighted to introduce my guest today, Professor Dr. Yeong Hong, who is a medical physicist and professor at Taylor's University's School of Medicine. She is the current president of the Southeast Asia Federation of Organizations for Medical Physics and the chair of the Medical Physics World Board of the International Organization of Medical Physics. She's a leading figure in the field of medical physics worldwide and has, throughout her career, secured over 3 million ringgit worth of grants. She owns 4 patents. She has published more than 100 peer-reviewed journal articles and has 3 academic books and 2 book chapters. So I'm absolutely delighted to introduce Dr. Yeong to the show. Welcome.
Thank you so much, Melisa.
What an incredible career
it's an honor to be here.
But I think we might need a little bit more clarity as to the field of medical physics. You are the first medical physicist I've had the honor of interviewing, and I'm curious to learn more about this field. Tell us a bit about the field and maybe how you began or you know, what led you to pursue a career in this field.
Yeah, sure. So medical physics is relatively not so popular professions in Malaysia. Well, actually we are scientists who are working in the hospitals. Normally you won't see us with the patients. We usually work behind scenes. Yeah, but let's say if you are familiar with cancer patients, so most of the cancer patients will go to radiotherapy treatments. And radiotherapy treatments are using like very sophisticated machines to treat the cancers and in very precision method. So the person who do the treatment planning is actually a medical physicist.
Oh, I see.
So it is not a medical doctor. Yeah. Oh. So a lot of public, they are not aware of this. But that's why I said we work behind scenes. So we are the one who are working in front of the computers, looking at the patient's body conditions and optimize the treatment planning for them. Yeah, and then we discuss, of course, we discuss with the oncologists, with the medical doctors to find the best treatment solution for this particular patient. Wow. So this is medical physicists.
So, and what led you to pursue a career in this field?
Wow, it's a long story.
Okay, okay.
So the journey can be traced back to when I was 12 years old. Yeah, so I was diagnosed with a heart murmur. It's a medical condition where the doctors found an abnormal sound in my heartbeat.
Oh, I'm so sorry.
It was during a normal, just a routine health screening in school. Yes.
Wow.
So I was caught. Then I was referred to a larger hospital to do the further checkup. So my father sent me to the hospital, and I've been in out the hospital several times, and gone through a lot of medical imaging tests. Yeah. So that included X-rays, ultrasound, Doppler ultrasound, and the ECG.
Okay.
So I was so amazed. It's like totally like fascinated by how these machines help the doctors to see inside my body. Yeah, because some machines, they produce images. Some, they can record the sound from my heart. And it was for the first time I was able to see my heart on the monitor screen. So it was an ultrasound image. So the doctor told me that, oh, this is your heart. Then I know, oh, my heart is this size, the size of the fist. Yeah, that was really like fascinating. And it really like sparked a strong curiosity in myself, and it's there for a long time. And I think that is the reason ultimately that shaped my current career.
That is a remarkable story. If your 12-year-old self could see you now, I mean, think about that. Yeah. So, and talk to me about your career. You have a specific field that you look into. Tell us a little bit more about how you've been able to contribute to research in this radionuclide therapy? Yes, maybe you can tell us more about that.
Yes. So maybe I need to explain a little bit about the journey. How can I become a medical physicist in Malaysia? So I applied for a degree course. It's called BSc in Health Physics. So it was the only program offered in Malaysia by UTM. So I was very lucky. So I got into this program. I got an A1 in my physics and biology. So I thought, okay, I can. I have the confidence I can do physics and biology. So I went to this field called health physics.
Health physics.
But it was a totally a relatively very new subject in Malaysia during that time. And to be honest, I totally had no clue what this field was about. And I had no clue where it would lead me. Yeah, it was later on, then I found out, wow, this is the job, this is the career that I was dreaming about all this while. Yeah, and then I did my industrial training in nuclear medicine department in HKL. So from there, I realized, okay, this is the profession that I want to dedicate my life to. So that's how I got into this field. But after I graduating from my BSc, I tried to apply for jobs in hospitals. Unfortunately, none of them accepted me because most of the vacancy, they required at least a master's degree in medical physics. Wow. Yeah, and that's how I figured out, oh, there is a medical physics program in Malaysia. Yes. So I spent a year working as a program engineer in an electronics company. Then I got enough saving, so the next year I applied for the Master of Medical Physics in UM. It was offered in UM, and ultimately continued with PhD, and I stayed on in UM, and they offered me the senior lecturer positions, and I had the opportunity to work in the medical center, UM Medical Center, yes. And I met my supervisor, my PhD supervisor, who is from the UK. Wow. So he is from Nottingham, UK, and he introduced to me radionuclide, which is in nuclear medicine. So there is a very niche area in medicine where we use radiation, radionuclide source, radioactive source, to treat cancer, to kill cancer. And at the same time, you can also use it to see through your body. So my PhD was about, we use a very small amount of the radioactive source. We label it, we take it into the drugs. For example, if you want to trace where this drug goes to, after you swallow the pill.
You sort of tag the, okay, and then you can monitor where it goes. I see.
Yeah, so that was my PhD project.
Amazing.
Yes.
Just to clarify, so radiotherapy, is that an alternative treatment to chemotherapy for cancer?
Yes. Radiotherapy is using external X-ray. It's a very high dose of X-ray, but it's shooting outside into the body, into the organ, and kill the cancer cell.
So is it the same as the REST prototype that your team developed?
Yeah, it's different.
Different, tell me more,
Yeah, so it's different concept. Radiotherapy is very standard treatments for cancer patients, most of the cancer patients, but our prototype is called REST. So REST stands for radio embolization samarium therapy. So it's a patented prototype. So I can share the secret.
Okay, yes. Tell us how you came to innovate this.
Yeah. So we actually developed microspheres. It's a specialized polymer. So it can be administered to our body. So it's biocompatible. And using these microspheres, we incorporate our radionuclide. It's called samarium-153. It's a specific scientific name. Into these polymers. And then we deliver the polymers directly into the tumor. We can see the tumors now under the guidance of the X-ray, and using needle or catheter, we can actually deliver our drugs directly to the tumors.
Is there a specific cancer or a location of tumor that allows for this?
Originally, we were designed it for only liver cancer patients because liver cancer patients, unfortunately, most of them don't respond well to radiotherapy because they need certain criteria to use external radiation beam. So we targeted on this patient, so liver cancer patient. And liver cancer is a high incidence rate in Malaysia.
Oh, I see.
Yeah. So we targeted patients who are not fit for surgery, not fit for radiotherapy, and they can't do chemotherapy, and they can come to us. So how we treat, we will use the needle or my catheter to deliver, to send our drugs directly to the tumors. Yeah. And this samarium-153, it has a very unique characteristics because it emits two types of radiation at the same time. So one is the beta radiation, the other one is called gamma radiation. So the beta radiation is high energy, but they can only travel very short distance. So we use it to kill the cancer cell directly. And at the same time, because it also emits the gamma radiations, then we can actually use the gamma imaging to see where our drugs is.
What a breakthrough!
Yeah.
This is remarkable. Was that an easy innovation, invention, or discovery? How did you come across it? I mean, I'm sure this was years of hard work and sweat and research. What were the challenges that you had to face and overcome to achieve such a breakthrough?
Yeah, definitely a lot of challenges.
I can imagine.
I started this research in 2012. So it's already 13 years. Yeah, so of course there are a lot of challenges along the way. But to me, we will take the challenge as an opportunity.
Okay.
So every challenge that we face is an opportunity to improve and to innovate. So there are multiple challenges. Can be from funding, to apply for funding, until the very complex technical difficulty. But one of the major challenge that our team has experienced is about ensuring our product is safe.
Oh.
Yeah, our products have to meet all the safety and regulatory standards to ensure that it is safe to be used for human later. Okay. Yeah. So why is it difficult? Because it requires actually the expertise, the experts from various fields. Yeah. So from there I learned about ISO standard.
Okay.
What is Medical Device Act? What is pharmaceutical, regulations and all. Yeah. So I have to learn about all this regulatory foreign language to me.
Yeah, I can imagine there are many regulations to protect patients and citizens, but to get through all of them, and it must have been quite confusing. So when you said you first started in this field, did you have anyone to guide you along the way? Was there anyone who could maybe kind of show you the way, or did you have to figure it out by yourself and pave your own path?
Of course, I have my own mentors. So they are basically my PhD supervisor as well. So we had this collaboration for very long term. But along the journey also, I built up a lot of collaborations with different experts. So I work very closely.
Locally or globally?
Both. Yeah,
okay.
both. So I work very closely with pharmacists, pharmacologists, doctors, physicists, engineers, lawyers, across various fields. Yeah. And I do get very strong support as well, locally in Malaysia as well as in other countries.
Is Malaysia, where are we in terms of positioning in the world of nuclear medicine research or medical physics? Are we a leader? Are we seen to be a leader? Are there other countries who are leading in this field?
Yeah, so medical physics has come a long way.
Okay.
The history, I think, is easily more than 100 years. Yeah, I'm not sure if you are aware, Marie Curie, who was the first woman who got a Nobel Prize, and the first person who won 2 Nobel Prizes in 2 different disciplines. Yeah. So Marie Curie, she was a medical physicist. So she discovered radioactivity, radionuclides, and she started to apply radiation in medicine.
Yes.
They have saved so many lives, even in many decades after her passing, right? So now we use radiation in medicine with more cautious and more knowledge.
Yeah.
Yes. So medical physics has been used widely. Radiation has been used widely in medicine more than 100 years. So we use it for imaging. We use it for radiotherapy as well. But recently, so we see the global trend, how we can combine the two into one. So we have like very advanced imaging technology. We work together with surgeons. So surgeons, the current trend is called personalized medicine.
Yes, yes.
Yeah. So they tailored their treatment plan to individual patients' needs, because different patient is different, right?
That is the future, right? Of medicine, yes.
Correct. Yeah, and they need our help as well, because we can provide them the input. We can help them to see through the body and to see through where their drugs go to. Yeah. So we need a multidisciplinary collaborations together to bring this further. And now is the era. Now is the era that we have like cross-disciplines collaborations a lot. And that is how we can go more advanced in medicine.
It's an exciting time to be in your field. Is this a field where women are underrepresented? I mean, are there a lot of, do you have a lot of female colleagues, both domestically and internationally?
Yes, interestingly. So the answer is yes and no.
Oh.
Because globally and in Asia, about 30% of medical physicists are women.
Oh, that's not equal.
Not equal, but our target is around 40%. But in Southeast Asia, it's a different case. In Southeast Asia, we have more women than men in this field. Yes, it is. Do you want to guess how many percentage of women medical physicists in Malaysia?
I don't know. 50? Is it equal?
No,
is it more?
It's not equal.
More.
More, yeah. We have 70. So
wow.
70% of medical physicists in Malaysia, they are actually women.
Why do you think that is?
Yeah, so Malaysia is an outlier in this sense, in the global
we're
statistics.
A leader.
Yeah, so we're an outlier there. They said, why you have more women? Majority of our women medical physicists, they work in regulatory bodies. For example, Ministry of Health. So in Ministry of Health also we have medical physicists who their profession is about radiation, so they know about how to safe use radiation. So they are working in the Ministry of Health.
So public sector, public health care.
Yes, public health care. So majority of our women physicists, they are working there. Yeah. But if we look back into the hospital-based medical physicists, the percentage dropped back to 30%, which is aligned with the global trend.
Okay. So why do you think that is? Why is it that in practice or out in the field that there is this gender disparity?
Yes, so my colleagues, she did a survey in 2018. So from the feedback that we collected, so we tried to analyze what are the challenges faced by the women medical physicists. So a few, so that include, first, they say there are limited mentorship opportunities. So they don't see many role models of women physicists in this field. And second, is the work-life balance. So they struggle for the work-life balance in these professions because the job requires us to work off working hours sometimes, because we look after machines actually. So the very advanced machines that we use in medicine, who looking after the machine is actually us, is a physicist. So we can only calibrate the machine or do the quality control test on the machines when the machine is not in use.
Right, so after hours.
After hours,
Got it.
yes. So sometimes we will work until midnight or started from midnight. So that is the nature of the work. So it's not the 8 to 5 job. And a lot of women, they cannot adapt their life because they have family to take care. And so that is a struggle there.
Yeong, if I were to ask you if you had, one thing that you would like to change about your industry to make it more inclusive for women, so that while we see a higher percentage of women, we don't see the distribution of women equally. What would you like to see change so that we can address that?
Yeah, I would definitely like to see the equality in performance assessment, because there are some unconscious bias there, right?
Okay.
They will feel that women at the younger age, they might have their family later, and it might jeopardize their work performance. So I hope that there is an equal system, in terms of performance. We just evaluate purely based on the person's capabilities. And also the leadership positions. So it has to be a transparent system. So we should throw away the gender bias, in terms of their performance assessment, as well as the salary gap. So from the 2018 survey, actually, we discovered, especially in the private sectors, generally, men earning more, higher than the women for the same position.
Wow.
So there are some unconscious bias there.
Yes, I can see.
So I hope the system can be more transparent and more fair. So, but please don't get me wrong that we are not here to push, to recruit more women in the field. We are actually advocating for equality, gender equality for both men and women. So for men and women who demonstrated strong interest or talents in the profession, we should provide them the equal opportunities to develop and to advance their careers. So that is one thing that I would really like to see.
Level the playing field, right?
Yes, exactly.
Are you seeing a lot of young people being interested in this field, particularly young women?
Yes, it is. So I also take advantage of my current positions. So as the president of the CFOM, so I make it a priority to have this so-called Women's in Medical Physics workshop. We have this workshop every year during our regional conference. So it provides a platform where we can invite our role model, our women role model, to share their journey and their insight. At the same time, we invite our young women colleagues to share the challenges that they face.
So they have, the support, right?
Yes, exactly. Then we will sit down together, then we discuss about the strategies, like how to overcome the gender equality issues and all. And it's also open to men.
So it's support for all. Actually,
Exactly.
I would like to ask you, what advice do you give them? So when you, young women and men come to you and say, well, they look up to you and they aspire to maybe have, a career in this field, what do you tell them?
Oh, I definitely love to meet them. I will love to support and guide our young generations. Doesn't matter the gender. Man or female, male, female, doesn't matter. I would like to provide them a supportive environment where they can openly share the challenges that they face. And I would also like to encourage, the top management to listen actively to the challenges that their employees face and provide them the meaningful support to break the barriers. So I believe that if you provide them a supportive environment and also to bridge the gaps to leadership, and more women and more young scientists can join the profession. Yeah,
that's great. In the couple of minutes that we have left, I'm curious to know, this field and the way you've described it to me is so exciting and full of potential. What's in the future for you? What are you looking to answer? Are there questions that you still have in this field that you're excited to answer?
Well, this field is still growing, still growing. And we see a lot of advanced treatments that really inspired me. And we started to see artificial intelligence is taking the lead in medicine now. So that is truly inspired me to see what the future will be and how can we use AI and robots to improve our treatment and also to optimize.
You mean this is something that can really happen? It's not, you think about science fiction films, right?
No, it is definitely happening. And it's definitely, I think, we are now moving towards the future where the treatments are safer, more effective, and also more accessible to everyone. We are moving towards the era.
Amazing. Dr. Yeong, thank you for coming on and sharing some of your remarkable highlights of your career. I appreciate your time. And
thank you very much for listening.
It was wonderful to talk to you.
Thank you very much.
That's all we have for you on this episode of The Future is Female. I'm Melisa Idris, signing off for the evening. Thank you so much for watching. Good night.
Thank you.